Okay, so I'm going to be doing my cumulative skills video. So the first thing I see is, so we have our patient here, Frances Christensen. She came in with some electrolyte imbalances and dehydration. So she already has 100, or 0.9 normal saline running at 100 an hour. And I see that in her orders that she's got potassium chloride, 10 milliequivalents in 100 mils IV to be given stat. So I checked my orders. I'm gonna check for allergies, and I see she has an allergy to betadine and codeine, so we can give the potassium. I'm going to go get my potassium from the Pyxis or wherever it is, and I'm going to do my 5 rights 3 times. So I have Frances Christensen, date of birth 3/24/42, getting potassium chloride, 10 milliequivalents in 100 mils, IV pig or IV stat, or at 3:55 p.m. I have Frances Christensen, 3/24/42, getting potassium chloride, 10 milliequivalents in 100 mils normal saline, IV at a stat or at 3:55 p.m. I have Frances Christensen, 3/24/42, getting potassium chloride, 10 milliequivalents in 100 mils of normal saline, IV stat or at 3:55 p.m. So now that I got my medication, I'm gonna wash my hands, enter the patient room, introduce myself. So, hey there, Frances. The doctors came, or your labs came back, and your potassium was low. So the doctor ordered some potassium for you. Could I get your name and date of birth? She says Frances Christensen, 3/24/1942. That checks out. on the doctor order form, the patient's date of birth is wrong, but on the MAR it's not. Anyway, I got sidetracked. So I check her date of birth, it checks out. I provide for privacy. I obviously already explained the procedure, and so now I'm going to hang you my medication. So make sure that this is clamped. And now, using the no-touch technique, I'm going to spike my bag and prime it. I'm not actually wasting that much, it's just there's some water left in the tubing. So, but since this is a medication, I wouldn't want to waste it. Recap this. Guardrail drugs. potassium chloride. Since it's going through the PICC line, we're going to hit central. Since it's going to be run at 10 milliequivalents over 100 mils, we're going to hit the third option, just because obviously our option's not on there. Oops, wrong one. So 10 milliequivalents in 100 mils. And then since it's 10 milliequivalents in 100 mils, that means we're going to be giving the full 100. Obviously, so there's that. And then I'm going to put on some clean gloves. And I'm going to check my insertion site. So making sure it's not swelled, there's no hot, she's not having any pain in her arm. Like I said, no swelling. It looks good. So now I'm going to connect it to my nearest port here. Cleaning it with alcohol for 20 to 30 seconds. And then letting it air dry. Connecting my tube. And then starting it and unclamping it. So now I would dispose of my supplies, make sure she's comfortable, get rid of my gloves, wash my hands, and then I would chart what time I gave it, how much I gave of it, location, and then how well she tolerated it. Obviously, a lifespan consideration. Obviously, potassium, it can burn, have a burning feeling with the patient. So, like maybe older people, I'll have to use the rate a little bit slower, as well as if they're if they need more fluids, we could run this as an actual primary with more saline, or if they have more. If they have like fluid overload, well, we could do it like this, just to make sure that the patient isn't getting as much fluids. So then now I'm going to check. I'm going to do my second skill. So I'm going to check my orders and see that the patient complained about abdominal pain at a 9 out of 10, and the doctor had ordered morphine 2 milligrams IV push, Q 1 hour PRN. I didn't say this, I don't think I said it, maybe I didn't, but I obviously checked the compatibility with potassium before I gave it. So then, anyway, so she's got morphine 2 milligrams ordered, so I go to the Pyxis and I would draw it up. So I already drew it up, and it was morphine 10 milligrams in 1 mil. So I did my math, and it would be 0.2 milliliters. So I have it right here in my syringe. And now I'm gonna do my 5 rights 3 times. So I have Francis Christensen, 324.42, getting morphine 2 milligrams IV push every hour, and the push rate would be over 3 to 4 minutes, or 4 to 5 minutes, my bad. Francis Christensen, date of birth 324.42, getting morphine 2 milligrams IV push at 3:55 p.m. or probably 4 p.m. Right? And then Francis Christensen, date of birth 324.42, getting morphine 2 milligrams IV push at 3:55 p.m. I think I only did it twice. Anyway, Francis Christensen, 324.42, getting morphine IV push 2 milligrams at 3:55 p.m. So now I'm going to check my compatibility in my drug book, because obviously with the allergies, with the allergies to codeine and betadine, So I check my compatibility. It's compatible with her allergies as well as the potassium and the saline. And it says here that it also needs to be diluted in at least 5 mils of saline and should be pushed over 4 to 5 minutes. So now I'm going to get my saline that I'm going to okay. Okay. All right. So now that I got it in here, I'm going to label it. So I've got morphine, 2 milligrams in 10 mils, and then my initials and the date, and obviously 10 milliliters. So now I'm going to wash my hands, introduce myself if I left the room or if this was further in time. Introduce myself, like I said, identify the patient. So say, hey Francis, could I get your last name and date of birth? She says Christensen, 32442. I provide for privacy, and I explain and I ask her, are you still having abdominal pain? She says yes at about 9 out of 10. So I say, okay, the doctor has got some morphine for you, so we're going to give it. She says, okay. So now I'm going to put on my gloves. And then, since I already stated it earlier, but if this was further in time, at a later time, I obviously would once again check the site, make sure that there's no redness or inflammation, no pain in the site. And since I already looked up the compatibility, and morphine is compatible with both potassium and saline, I'm able to just put it in the nearest Y port without having to flush it, do a pre-flush. So I'm going to clean off my site. And like I said earlier, the push rate has to be between 4 to 5 minutes. So I clean my port off 20 to 30 seconds, let it air dry. I got my morphine here. Oops. And then I'm going to be administering it over 4 to 5 minutes. And since this is a fistula, we're going to be doing the pulse. So slowly pulsating it to administer it. So I'm just going to speed it up, obviously, because I don't want to sit here for 5 minutes. But obviously in the clinical setting, I would infuse it over 4 to 5 minutes. Okay. Get that. Now I would clean off my port again for the post flush. And then for the first 5 mils, I'm going to be pushing it at the same rate as the morphine, so over the course of 4 to 5 minutes. So once again, I'm not going to sit here for 4 to 5 minutes, but in a clinical setting I would. Obviously having a watch is pretty important. So then once I hit the 5, or I push the first 5 in, I can push it regularly. Once again, obviously doing that pulsating administration. Okay. Alrighty. And then obviously I would clean up my supplies, make sure that Frances here is comfortable, get rid of my gloves, wash my hands, document document what I just gave her, so the morphine, how much I gave her, the 2 milligrams, where I gave it, IV, her reaction. While I'm pushing the morphine, I obviously want to be looking for any adverse reactions that she could be having. Lifespan considerations. Obviously, like older people, we may have to push it slower, may have a smaller dose. And then after, since she was having pain, 15, maybe 20 minutes later, I'll come back in, reassess her pain level, see how she's doing, if she needs any more intervention to help get rid of that pain. So then I'll leave the room, a couple hours go by, I check my orders and see that that her PICC line needs to be changed, so her dressing on her PICC line. So, and then I gather my supplies, which is my central line dressing kit and my sterile gloves. So I got my stuff. I'm gonna wash my hands, introduce myself. Hey Frances, I need to come and change your PICC line. It's a couple days old, is that okay? She says, yep, that's okay. Provide for privacy. Obviously, like I said, I'll explain the procedure. So we're gonna take it off, clean it, put a new one on. I'm gonna check for her allergies. So obviously she's allergic to codeine and betadine. If she was allergic to isopropyl alcohol or CHG, we would then use betadine to clean it. But since she's not, we can use the alcohol and the CHG. So I'm going to get my central line dressing kit open. And I'm going to place down my sterile field. Obviously, Frances here would pick up her arm, so I wouldn't have to do it for her. I wouldn't be touching this, but and then, so now I'm gonna wash my hands. I already have a mask on, but I would put a new mask on, and then I would give Frances her mask. If she can't not tolerate the mask, I would have her face the other direction, just because it helps prevent the spread of infection and contamination. So now that I got that, my mask on and her mask on, I'm gonna wash my hands again. Put on some clean gloves. Like I said earlier, some time has passed, so once again, I'm gonna check her IV, make sure that there's no inflammation, it's not hurting, it's not hot to touch, and then I'm going to measure the PICC line. So 6 inches above where the PICC line is placed, I'm going to measure her circumference. So rough, so 10 inches. If there's any variation in at half an inch, so if it's increased about half an inch, that could warrant infection or phlebitis. So we want to obviously compare her measurements now to her baseline, and we're also going to want to measure the length of the catheter itself. Alrighty. So like I said, I obviously already had checked this for my Rita, if it was infiltrated and all that. So now I'm going to remove my dressing. So obviously making sure my hand is secured here, and I'm going to pull, if I can get it off, I'll pull towards the site. I didn't mention this earlier, but when we were giving the PICC medication, we are going to want to verbalize why she's getting it through the PICC line. So she obviously, in the report sheet, It says that they had a hard time getting the peripheral IV in, hence why they gave her the PICC line. And she also was receiving some chemotherapy earlier. All right, so now that the dressing's off, I'm going to look at the dressing, look for anything with the coca, so color, odor, consistency, amount. As you can see, there's no drainage. As of right now, I'm going to remove my clean gloves and then wash my hands again. And now I'm going to don sterile gloves. And I'm going to take my forceps with my non-dominant hand, and I'm going to pick up on the PICC. And then, so I would have more than one of these, but this is just some alcohol. So what we're going to do is we're going to clean in a circular motion around the site. I would throw this one out, get a new one, and slowly go more and more out. Maybe throw this one away. And then if the catheter itself would be dirty, I would clean the catheter, obviously, rotating the alcohol swab so that it's clean each time. I would then throw this away. I didn't verbalize this, but I would have, when I took the dressing off, I would have inspected the hub, made sure that was intact, and making sure that was okay. Then I would get my CHG. I would squeeze this to crack it open, shake it maybe a little bit, and then with tension, I'm going to do it in a window or square-like motion. And then I would throw this away then. And then I would have my skin prep. And then once again in a circular motion, or not circular, window motion or square motion, do this. And then I would allow it to then dry. Carefully place this back down. Throw these away. And then I would grab my Tegaderm. And then I would then remove this, if I can get it. Oh my God, the whole thing's coming with. There we go. And then I would take the tape, I would secure it if I needed. If it wasn't secure already, other than this one piece of tape, I could put more tape on it. But with this tape, I'm going to put my initials and the date and time of when I changed this dressing. I would then I would throw out all my equipment if I didn't do it already. Remove my gloves. Make sure that Francis here is okay. So remove my gloves. Get them off. Remove my gloves. wash my hands, take off my mask, take off Francis's mask, wash my hands again. Then I would make sure she's comfortable, give her her call light, you know, maybe see how her pain's doing, maybe she needs more morphine. And then document the dressing change, the time, how well it was, you know, the coca, if there was any, Rita, and the PICC line site. And that's my cumulative.